Okay, so I'm going to be preparing an enteral feeding for a patient. So the first thing that I would do is verify my doctor's orders. I would identify patient, so I'd have the patient state their name and date of birth for me. I would ask the patient if they have any allergies. Then I would wash my hands. I will don clean gloves. I will position patient into a high Fowler's position. I'll grab my enteral nutrition feeding can. I will shake up the formula. At this point, I will pour it into my enteral feeding formula bag. I will go ahead and connect my feeding to the pump. I will open it up and allow it to prime. Once I have it primed, I will close that back up. And at this point, I'm going to be checking for gastric content, or checking for the pH. So I'm pulling up gastric content, placing it on my pH strip. Here's my pH strip there. And it's showing a pH of 2. The color consistency is about a color of green. After I've done that, I'm now going to check for gastric residual. So once I'm pulling back, I'll pull back until I no longer can get any more residual. And at this point, if you have less than 250 mils of residual, then you can go ahead and return the feedings. If you have greater than 500 mils or 2 checks of greater than 250 mils, then you would stop the feeding and you would not return the feeding back to the patient. So I checked that. And at this point, I would go ahead and pull up 30 mils of water. So I have 30 mils of water pulled up here. And I would flush the tubing. And at this point, I can go ahead and connect my feeding and turn the feeding pump on and allow the feeding to go. Now, if I was doing a bolus feeding, I would just hold the tubing up, and with my syringe, I would first pour 30 mils of water in and allow gravity to go through. Then I would pour my nutrition formula in, allow that to go through, and then I would follow that with 30 mils of water. So after all that's been done, I want to make sure that my feeding bag and my administration set would be changed every 24 hours. You want to check gastric residuals every 4 to 6 hours. And if you were giving it on the abdominal site, you want to assess and clean that daily. But we gave it an NG tube site, so I would just assess and clean that daily. I'm going to remove my gloves. I'm going to wash my hands, and then I'm going to document the procedure. So I'll document it, how the patient tolerated the feeding, how much residual the patient had.